Today, this article was introduced. The name of my article was Relationship between Clinical Competence and Corpus Learning Style of Clinical Practice, Education in Nursing Students. Introduction was followed. In the nursing curriculum, knowledge is learned through theory and through practical training. The knowledge and skills learned in the school are integrated to develop lesser nursing skills. For this purpose, a clinical training course that applies the theory to practice is indispensably required. And for effective clinical training education, the learning style and preferred learning method of nursing students as that actual study subject have an important influence on the nursing education. The purpose of this study is to identify the clinical competency according to the learning style in the clinical training education of nursing students and to provide the basic data for the clinical training education by compounding and difference according to the learning style and ultimately contribute to the qualitative development of nursing education and nursing practice improvement. Method were followed. This study is a descriptive research study to grasp the relation with clinical competence according to the learning style of nursing students. Research tools: first, Kolb's learning style, and second, clinical competence. Participation and data collection were followed. The study utilized convenience extraction to select 150 nursing students in third and fourth year attending one of two universities and located in K province who underwent more than 6 weeks of clinical training, who understood the purpose of search and gave consent to participation. And a total 143 copies were utilized, including incomplete responses. Data analysis were followed. The collected data were analyzed using SPSS 21-point program. The general practice and learning style of nursing students were analyzed using frequency and percentage, and degree of clinical competence was analyzed by mean and standard deviation. The difference in clinical competence between general practice and learning styles of nursing students was analyzed by t-test, ANOVA, and CEPHAL. Pearson correlation coefficient was used to analyze the correlation between degree of clinical competence and learning style of nursing students. Research were followed. In the difference of clinical competence according to general practice of subject, school satisfaction, and clinical training period and clinical training satisfaction were found to be significant. And second, in the learning style degree of the subject, debugger, assimilator, converger, and accommodator was found to be 23.1% and 31.5%, 20.2%, and 25.2% respectively. And third, there was a significant difference in the nursing process among sub-variables of clinical competence in the analysis of the difference of the different clinical competencies to the learning styles of the subject. And first, as a result of analyzing the correlation between learning style and clinical competence, there was no significant relationship. Thank you.